An all-female team of medical professionals in Alaska trek by plane, sled, and snowmobile through sub-zero temperatures to safely deliver the COVID-19 vaccine to people in need. And they're just one of the many teams helping to make Alaska the state with the most COVID-19 vaccinations per capita in the entire country. Our Kana Whitworth has their story.
Based in Kotzebue, Alaska, 33 miles north of the Arctic Circle, the all-female team boards a bush plane, one built to fly further north into rugged territory.
We were all willing to crawl around to try to get into this tiny little plane. We were all willing to hop on the sled if we needed to.
With just a few hours of daylight in sub-zero temperatures, Dr. Bengard, 2 nurses, and a pharmacist have no time to waste. Once they land, villagers drive out to them on snowmobiles. The women load up in a sled and are pulled the rest of the way into the village.
It was somewhat unknown. I'd never been to any of these villages, so it was kind of an adventure trying to figure out, well, where's the town from here and where are we going to go? And yeah, we trusted the driver and we hopped on.
Waiting for them are the village community health aid practitioners, or CHAPs. They live in the villages and they're on the front lines of healthcare in these rural, hard-to-access communities.
We're the eyes and ears for our providers.
Some 550 CHAPs are spread out over 170 rural Alaskan villages. Their relationships with the elders, and for some, the ability to speak the native language is essential to provide the right care for these locals.
Learn your native language and you start to work with elders that really don't speak English. You could even just look and know what they're saying.
Villagers that can descend to the clinic and wait in the bitter cold to be vaccinated.
They come to the clinic. Some of our chaps will go ahead and make sure that all of the paperwork's done before we get there. So we just have to screen the patient. They just come, all together as a community and we vaccinate. We try to take care as best as we can.
Some elders, unable to reach the clinic themselves, require home visits.
Myself and a nurse packed up to go out. Our pharmacist who was with us prepared the vaccine. And the way that she did that is she had to de-thaw the vaccine and then draw it up into a syringe. And then between the village clinic and the house, we had to make sure that that vaccine didn't refreeze.
So you're worried about the vaccine actually freezing inside the needle?
Correct, exactly. Yep. So what we would do is she would draw it up in the clinic, so obviously it's warmer there. And then what we did, we put it in a padded envelope, like a bubble wrap envelope, and then my nurse held it close to her body as we hopped on the snow machine to get over to the home visit.
I mean, there's real ingenuity there.
Well, we did the best we could. We had to kind of come up with it in the moment. We made it work and we had a really good time together.
On this day, they traveled hundreds of miles, vaccinating 65 people. These women are part of a larger healthcare team sending people into the Arctic several times a week to service these 11 villages. Efforts like this are happening across the last frontier. Alaskan State Senator Donnie Olson was vaccinated near his home in rural Golovin.
Well, I think it shows the level of commitment that the health corporation, the personnel that work for the health corporation have to try and get this life-saving vaccine out to the end user, which are the elderly and the people that are most vulnerable, as well as the essential workers that are out there.
Nurses like Daryl Bach in Homer, Alaska, often fly to service villages several times a week, but during the winter, the weather doesn't always allow it, so they rely on the unfavorable seas.
But, you just have to be adaptable. And frankly, this is Alaska. This is something that, we have unpredictable weather here, and this is just something we have to deal with. This year we've had much windier days than we've normally had. So that's put a real challenge on us getting over here.
Captain Kurt Jackson navigated treacherous waters to deliver 5 nurses and the vaccine.
I just told him, it's going to be a bit of a bumpy ride. And this woman kind of clutches this blue box a little bit more. All of a sudden, the boat starts to take these big 30-degree swings. I mean, it's pounding through. So I tried to go as slow as possible to get them through.
I really feel safe with them because they really stick to those minimums. And, there are a lot of people who will push it and take chances. And, I've got quite a number of people that I know of, friends of mine that took chances and ended up paying the price and dying.
They arrived safely in Seldovia.
I was definitely emotionally choked up, feeling like this was a moment where we kind of were starting to do something positive here.
It's all part of the commitment these healthcare professionals make to service the rural villages that are mostly cut off from the rest of the world, but not forgotten about.
Thanks to Kenna Whitworth, and thanks and congratulations to that team of women up there just doing amazing work.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.